Welcome to PT Microlessons, fast lessons with big impact. In this video, we will cover electrotherapy for pain modulation. In physical therapy, pain modulation is often described in different ways. Sometimes it is described in terms of settings, such as high rate or low rate TENS. Other times it is described based on the type of current and waveform being used, such as interferential current. So let's work through how to make sense of it. It is important to recognize that the terminology is not always consistent. What I have found most helpful is understanding the differences between pulse current and alternating current. From there, it becomes easier to determine what is being described and how it applies in clinical practice. So, where do we start? As clinicians, we begin with the treatment goal. In this case, the goal is pain modulation. Next, we decide on the type of response we want to produce. Do we want a sensory-only response, or do we want a sensory and motor response? This decision will guide the settings we choose. You will often hear the terms high rate and low rate TENS used when discussing pain modulation. High rate TENS typically refers to a sensory level response, while low rate TENS refers to a motor level response. Now that we've identified the response, the next step is choosing the type of current. We can use either pulse current or alternating current. This decision matters because the sensation the patient feels, the electrode setup, and the specific settings will differ depending on the current we choose. Okay, let's apply this using pulse current, starting with high rate or conventional TENS. With high rate TENS, we are targeting a sensory level response. This activates A beta fibers, reducing pain through the gate control mechanism. It is typically used for faster relief of more acute pain, with treatment times around 20 to 30 minutes. So, let's set up high rate TENS using the FITT framework. We already addressed type by selecting a sensory level response for pain modulation. Now we need to adjust the remaining settings to achieve that response. Since we are using pulse current, we can directly set both the frequency and the duration. For high rate TENS, we use a higher frequency, that is, a high rate. It is typically 100 pulses per second or greater. The pulse duration is shorter, around 50 to 100 microseconds, which helps maintain a sensory response without producing a muscle contraction. A simple way to remember this is 100 and 100. Lastly, the intensity should produce a strong but comfortable tingling sensation. Because the goal is sensory stimulation, it should not produce a muscle contraction. The higher frequency helps maintain that sensory response. It is also important to remember that intensity varies between patients, and even from session to session, so it should always be adjusted based on patient feedback. Now let's look at low rate or acupuncture-like TENS. Low rate TENS activates A beta and A delta fibers and produces a motor twitch response. It is used for pain modulation and may provide longer lasting relief compared to high rate TENS. This effect is thought to be related in part to activation of endogenous opioid mechanisms. Treatment time is typically around 20 to 30 minutes. Let's walk through the steps for setting up low-rate TENS using pulse current. Starting with type, we are targeting a motor level response for pain modulation, which includes both sensory input and a motor twitch. Since this is low-rate TENS, we use a lower frequency, typically around 1 to 10 pulses per second. The pulse duration is longer, usually 200 microseconds or greater, which helps facilitate a motor response. The intensity is set to a motor level, meaning you will see a noticeable muscle twitch. Now, let's look at setting up high and low rate TENS using alternating current. The goal remains pain modulation, and we are still choosing between a sensory or a motor response. However, with alternating current, there are a few key differences to understand. Instead of setting the frequency directly, as we do for pulse current, with alternating current we use a beat frequency to determine the treatment effect. Also, for alternating current, the time or duration is not set directly by the clinician, but is determined by the device's carrier frequency. Okay, let's look at how to set up high-rate TENS using alternating current. Starting with type, we are targeting a sensory level response for pain modulation. Instead of setting pulse frequency, we use beat frequency, which determines the treatment effect. For high-rate TENS, we set the beat frequency to 100 Hz or greater. Some devices let you choose the beat frequency itself, while others require you to adjust the second carrier frequency. If you look at the top example, the beat frequency is set directly, here, to 100 Hz. In the bottom example, the second carrier frequency is adjusted to be 100 Hz different from the first. In both cases, the result is the same, a beat frequency of 100 Hz. As I mentioned earlier, a key difference with alternating current is that the time or duration is preset by the machine's carrier frequency and is not directly adjustable. In this example, the carrier frequency is set to 4000 Hz, which is commonly used for alternating current waveforms such as interferential and premodulated. Now we can wrap up with intensity, which should be increased to produce a strong yet comfortable tingling sensation. Okay, let's look at low-rate TENS using alternating current. Starting with type, We are targeting a motor level response for pain modulation, which includes both sensory input and a motor twitch. The frequency is set using beat frequency, typically between 1 and 10 Hz. The time or duration is not set directly by the clinician. Instead, it is determined by the device's carrier frequency. The intensity is increased to produce a visible or palpable muscle twitch. Now let's look at how two of the most common alternating current modes, IFC and premodulated, are set up. This image shows how IFC is applied using a crisscross or X pattern for the electrodes. Thus, IFC requires 2 channels and 4 electrodes. In the graphic, one channel is labeled L1 and the other is L2. Each channel delivers its own carrier frequency. These currents travel through the tissue in different directions and intersect. At that point of intersection, the beat frequency is created within the tissue. This central area is the target treatment zone, where the patient experiences the stimulation. And this is why we cross the channels with IFC, to ensure the currents intersect and create the desired effect. With premodulated current, the beat frequency is created within the machine, so we use a single channel and place the electrodes in a parallel setup. Both IFC and premodulated can be used to achieve either a sensory or motor response depending on the settings. To summarize, we always start with the treatment goal, which in this case is pain modulation. Next, we choose the type of response we want, either high rate 10s for sensory or low rate 10s for motor. High rate and low rate describe the type of response, not the specific current being used. Then, we select the current, either pulsed or alternating. With pulse current, we can directly set both the frequency and the duration. With alternating current, we set the beat frequency, while the time or duration is determined by the carrier frequency. So the key idea is that the goal remains the same, but the setup differs depending on the type of current.
That's it for this PT Microlesson. Like and follow @PT Microlessons for more fast lessons with big impact on physical therapy topics.